Hello everyone, welcome to my YouTube channel. Today we'll be discussing Norma frontalis. Norma means an aspect of something considering skull hair, and frontalis means the frontal aspect. So in this video we'll be discussing the frontal aspect or the skull as viewed from the front. So let's begin. The frontal aspect or the norma frontalis, it is oval in outline, wider above than below, wider above than below. The bone seen in the norma frontalis is the frontal bone, which forms the forehead. After that is the nasal bone, right and left, forming the bridge of the nose. Then is the zygomatic bone, right and left, forming the cheek prominence. After that comes the maxillary bone, right and left, which forms the upper jaw. Next is a separate bone, which is the only movable bone of the skull, known as mandible. It forms the lower jaw. After that, if we talk about the sutures, the suture which is present between the nasal bone, two nasal bones, and the frontal bone is the frontonasal suture. Suture present between the two maxillary bones and the frontal bone is the frontomaxillary suture. Suture present between the two zygomatic and the frontal bone is zygomatico-frontal suture. Suture present between the nasal and the maxillary bone on both the sides is nasomaxillary suture. Suture present between the two nasal bones forming the bridge of the nose is the internasal suture. Suture present between the zygomatic and the maxillary bone, each side is zygomatico-maxillary suture. Suture present in between the two maxillary bones is the intermaxillary suture. Now we'll be studying norma frontalis in three different parts. Let us first talk about the first part, the frontal bone. The frontal bone has a rounded curved elevation which is situated just above the medial part of the orbit, which overlies the frontal sinus. It is known as the superciliary arch or the supraorbital margin. This is better marked in males than females. Next up is the frontal prominence cuba or the eminence, which is the low rounded eminence above the superciliary arch, one on each side, better marked in females and children. After that comes a medial elevation connecting the two ciliary arches, which is known as the glabella. Below glabella, the skull recedes to the frontonasal suture at the root nose. The medial point at the root of the nose, where the internasal sutures meet the frontonasal suture, is known as nasion. Now, if we talk about the orbital openings, they are quadrangular in shape. Next, coming up to the borders of the orbit, the superior border or the supraorbital margin, it is formed by the frontal bone. Okay, see here, this. At the junction of lateral 2/3 and medial 1/3, a supraorbital notch of foramen is present, which contains supraorbital nerve and vessels. The inferior border or the infraorbital margin, it is formed by the zygomatic bone laterally and maxilla medially. Next, the medial margin, it is ill-defined. Okay, this is the medial margin. It is ill-defined. It is formed by the frontal bone above, lacrimal crest of the frontal process of the maxilla below. Next is the lateral orbital margin. It is formed by the frontal process of the zygomatic bone and the zygomatic process of the frontal bone from above. Okay. After that, coming up to the interior bony aperture of the nose, also known as the piriform aperture. It is a pear-shaped aperture being wide below and narrow above. Wide below and narrow above. Now, if we talk about the boundaries of the aperture, superior boundary is formed by the lower border of the nose, and the inferior boundary is formed by the nasal notch of the body of maxilla on each side. These are the nasal notches. Anterior nasal spine is a sharp projection in the medial plane in lower boundary of the piriform aperture. Then comes a point known as rhinon. It is the lowermost point on the internasal suture. Coming up to the maxilla, the anterior surface has nasal notches, anterior nasal spine, and infraorbital foramen. Incisive fossa above the incisors, canine fossa, lateral to the canine eminence. See, this is the canine eminence. Lateral to the canine eminence is canine fossa. 3 out of 4 processes of maxilla is seen in the Norma frontalis, which is the frontal process of maxilla, which articulates anteriorly with the nasal bone, posteriorly with the lacrimal bone, and superiorly with the frontal bone. Then comes the zygomatic process of maxilla. It is short, but it articulates with the zygomatic bone. After that comes the alveolar process of maxilla, which bears the socket for the upper teeth. Coming up to the zygomatic bone. The zygomatic bone forms the cheek prominence, and a foramen is present on the zygomatic bone known as the zygomaticofacial foramen, from where the zygomaticofacial nerve, which is a branch of the maxillary nerve, passes. Coming to the mandible, it forms the lower jaw, the upper border of the alveolar arch lodges the lower teeth. The lower border is rounded. A midpoint of the base is called the mental point or gnathion. Then mental foramen is present, from where the mental nerves and vessels passes. A point on the angle of mandible is known as gonion. So this is it about the Norma frontalis or the frontal view of skull. Now do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss the latest updates. Let me know in the comment section below if this video has helped you in any way. Stay tuned, keep visiting. Thank you.